Good evening. My name is Tenny John-Idiagbonya, a student of Brandman University, and I am writing or speaking on my evaluation summary for my clinical experience after completing the 510 hours with the 645 course. My clinical experience was started for the description of the facilities and the preceptors. My clinical experience was initiated with two clinical sites, and halfway or a month into my clinical experience, I included a third clinical site. The first clinical site that I started with was Faith Healthcare Center, which is being run by Dr. Fadaju, Mercy Fadaju, and the second center is Sunachi Health Center, Healthcare Center, and it is being overseen by a psychiatric nurse practitioner by name of Miss Florence Warner. And the third clinical center that I used was the ABA Health Systems Healthcare Services, and the precepting psychiatrist was Dr. Mahmoud Malayeri. In addition, I had opportunity to have psychotherapeutic exposure experience at that site. The first site I will talk about is with Dr. Mercy Fadaju. Is a private practice owned and managed by my preceptor, and in that site she would see children, see clients, psychiatric clients across the age continuum. She is actually a family nurse practitioner and a psychiatric nurse practitioner, and holds a doctorate degree in nursing. The clients that we saw, again, like I said, range from young children to old adults, and were able to provide assessment, diagnostic evaluations, and medication management for psychiatric patients. Most of the patients were patients that had been stabilized from prior hospitalization, and they were discharged into the community and required continuous medication management. Some needed medication management. They were in the community, had not had prior hospitalization, but were presenting with symptoms, and they either brought themselves in or they were brought in by family or loved ones who sought help for them, and they were able to be evaluated and diagnosis determined with the appropriate intervention treatment-wise for them. Also, psychotherapeutic care was also provided at the center, as a psychotherapist. Actually, therapists came to the center about 2 days a week to provide psychotherapeutic care for the clients that needed that care. And the clients also were able to receive care. Those that needed, that were receiving medications, treatment for substance use, they were also managed at the center. We also provided care for the elderly population, those that were dealing with life changes, depression, and to help them, work with them, provide an atmosphere where they could, talk and be comfortable and just unburden, which they found quite therapeutic for their situation. The other center with Miss Florence Warner also provided care for clients across the age continuum, Um, well, we provided pretty much the same care. The first center, the Dr. Mercy Center, Health Faith Health, was in a different area, more of the tending to a different kind of population when compared with Miss Florence's center. So we had the downtown community and the opposites um, kind of setting. So our clients slightly were varied, but we also found the situations where even clients from the downtown setting would come over to the city, so to say, for care because they are comfortable with the provider. Um, and then the third center, in terms of description of the facility, was it was an outpatient, also an outpatient center that provided care for clients again across the age continuum from a child to up to an adult, an older adult population. It provided medication management, psychotherapeutic care, provided anger management groups for the clients, and substance use management for those that were going through the detox process, and those that wanted help with getting off the use of substances. Now, these centers provided an environment for the clients, some of which, after being stabilized on their medication, will come on a weekly basis for the therapeutic group sections. We had group sections for anger management, for social skills, coping, for those that were dealing with staying clean with respect to drug use. Also, these groups provided the opportunity for them to celebrate their successes and also share their failures, where they are encouraged and support is provided for them as to how they can better be successful in their decisions. And also, we had the opportunity to provide them, to guide them to the resources that were available in the community for those in need of community assistance. So my experience with the clients also, and this center, the ABA center, was also in the downtown setting. So we saw a good number of diverse population, because not only were we seeing patients in the downtown community, but patients were coming from the city to come get care, the urban setting, to come get care for themselves, their loved ones. And we had managed clients that had children with ADHD, behavioral misconduct issues, to adults with depression. We had schizophrenic issues that we managed. We had issues with clients with obsessive compulsive disorders, for example, that we also managed. Description of my best and my worst. I would say I had a great experience because it was because of the settings. There was always something to learn. The worst experience I would say I had was when a client with compulsive disorder, misconduct, had an issue with. He was asking to get a dog, that would be his new coping skill, and his age that was with him didn't quite understand the ramifications. And when the provider tried to explain this to the client got upset and started making threats. And when I would try to talk with the client outrightly spat in my face. That was the worst. Um, but I also tell myself it could have been worse. The situation could have been worse. Thank God it wasn't. That was where it ended. But other than that experience, and I learned from it how to manage such situations, how not to continue to engage the client at that time. It would be best to step back and allow the client to calm down and um, choose another time to go through the situation, because at the state when the client is that upset, he or she is not willing to listen to any voice of reasoning. And that was an experience I learned from them. But overall, my experience was, it was superb. I was thankful, and it's um, granted me the opportunity to review my readiness to actually care for this client. So in areas where I was uncertain, this client populations, in areas where I was uncertain, where fear was of not knowing what to expect, the anticipation and all of that, I was able to see a glimpse of it. And I it gave me more confidence that this population, this client, this psychiatric clients and their family, there is a need to provide empathic care for them. And I embrace, and I'm ready, and I embrace that that calling. um Personal changes. Yes, personal changes. Some personal changes that I've gained from this was, becoming more patient, more empathetic with my client. And not it allowed me also to look at areas where I actually have some form of prejudice. How do I see these clients that are presenting with symptoms? Are there, thoughts that makes me my decision, my thought process biased in any shape or form? And one of the things that actually also informed that was after we watched the video of the suicide attempt by Kevin Hines. That video keeps coming back to me, and I actually go back to just review it. It developed in me more empathy for these clients, because when they are going through the symptoms, when they are having the crisis, what they need is much more deeper than most of the time we recognize. So it's overall is a field that I'm excited to get into, and I'm thankful for my preceptors who gave me the opportunity to learn under their preceptorship. They were excellent preceptors, and I will recommend them for any student that is willing to learn. And like I told them, I'm ready to come back to come volunteer, with them, because I really did learn a great deal from them. And I'm thankful for Brandman for giving me the opportunity to also learn with them and learn about caring for psychiatric clients. Thankful for my instructors for this course. Thank you.